It's 2 p.m. on a Wednesday afternoon. Thanks for tuning in to Cannabis Legalization News, where we explain marijuana laws so you can change them. Today, we are joined by Jackie Cornell from 1906 New Highs. We're going to be talking about the social impacts of cannabis legalization. But first, we do have to get into a little bit of cannabis legalization news. So, Tom, Miggy, what's going on in the news this week?
Olympus is down.
Yeah,
I hear that. Let's share that screen real quick. So for the first time, and thank you for joining us for another exciting episode, historic episode of Cannabis Legalization News. It seems like every week we make history with cannabis legalization, and we did last night. Thumbs up, and thank you for subscribing and tuning in. But right now, real history, protesters have stormed the Capitol, forcing Senate evacuation during electoral college count.
These guys are the opposite of what they say they are, like the Patriot thing.
Yeah. There's nothing patriotic about disrespecting the rule of law.
Yeah. It's more of an insurgency. You're more of a terrorist at this point. But we did flip the two.
That's what it is. I mean, and so it wasn't looking good when we signed off, but it had only been an hour. And then by the time I went to sleep last night, Warnock had already gone ahead. I don't think they had called it. When I woke up this morning, they called the Warnock seat. So right now it's 49-50. Some news outlets like BuzzFeed and Vox have already called Ossoff as the winner over Perdue. So it'll be a 50-50 Democrats and Republicans split, with Kamala Harris being the tie-breaking vote.
This is the real chance now. Once we get this done, and then the pressure's going to be on getting it through. What did it pass last time? Was it the Senate or the House?
It's passed the House because the House was controlled by Democrats. However, we can do the math on it right now and say, well, 97% of the Democrats will vote in favor of it, and 97% of the Republicans will vote against it. What does that come down to? Then, if so...
comes down to a vote.
Basically washed. Is it going to come down to Kamala? Because Kamala's she was a sponsor of the MORE Act. That would be freaking epic if she's the deciding vote that votes for her own bill as the president of the Senate, and then it sends it to Joe Biden's desk. And that's when you're going to really start to see a lot of that social equity aspect that is not only in the MORE Act, but also in various other state laws. It'll be... I don't know. What are you giving the odds that the Democrats pass the MORE Act in the next 2 years?
They better pass it, or else
voters are going to be pissed.
This past 4 years have proven that. Actually, this past 3 months have proven that Americans, we actually tired of people's we don't want to be so divisive all the time. We don't, there was no the politics, man. Watching it today, it's all dog and pony show. But the fact that these guys,
there was politics today that came out as well. Merrick Garland today was named as not Obama's Supreme Court pick, but Obama's Supreme Court pick Merrick Garland is Joe Biden's Attorney General. That was named hours before the, I guess we can call them, tyrants or fascists that have stormed to the level, the Capitol are there. But what did Merrick Garland say in a 2012 LA Times story where he was on a federal 3-judge panel hearing an appeal by the Americans for Safe Access over whether the DEA should reschedule cannabis?
You wanted to wait till to hear from the scientists.
Yeah, don't we have to defer to their judgment on what the medical studies show? We're not scientists, they are. But that implies that the DEA is scientists, which is just so way off. The DEA is not scientists.
But we'll have one next week, and we can ask some pretty important questions.
Oh my gosh, next week. Hopefully the coup is over by next week. And so when we have Dr. Ethan Russo on the show next week, if you have any amazing cannabis science questions that you want to get and answered from Ethan Russo, Dr. Russo, please tune in next week. We're going to have all sorts of interesting questions regarding the cannabinoids, the interplay of CBD and THC, the lesser cannabinoids, how those are created, how the terpenes are created, and then maybe we can explore and have him explain that thing that Max Simon spoke about when he was talking about his Ganjier certification, the 6 various types of cannabis cannabis-like cultivars that are out there for medical use.
I saw, I was just thrifting the other day, and I saw in the expensive part of the thrift shop was somebody donated wine samples. It was called Making Sense of Wine. It was like a bunch of little tubes of wine, and that's gonna be the next level for cannabis, right? Like it's gonna be little tubes of terpenes, and you can identify different aromas and whatnot.
Oh, I can't wait. Like just like a brewery is able to do beer flights, right? You've had a beer flight at a brewery before.
Oh,
It's marvelous. You have like 4 or 5 little like 4-ounce beers, and then like these breweries are able to show off their wares, and it's delightful. Now imagine that you had like 4 or 5 clean chillums, like glass, nice, and then 4 or 5 little not even a half a gram. This would be like, a 1/10 of a gram. So like matchstick size heads, like enough for a chillum, a personal.
Sure. Like little tokes.
Yeah. Like the taste, like you could have weed flights, and it's like, oh, let's compare this grapefruit next to some Skittles or next to some Jack Air.
Well, and then you get one of our local rags here, Northwest Leaf. They do terpenes and tannins, like with wines and weed, or beer and weed. It's a pretty great issue, I think.
See, that's really the nice stuff that's going to be happening, especially more and more now that the Democrats have taken control over the Senate. That the what do they call that? Consumption lounge license type. The consumption lounge license type is going to have a lot of fun for the consumer. Buying and consuming cannabis currently in the United States is nowhere near as enjoyable as buying and consuming alcohol, because alcohol is way more socially accepted. And then also you can have commonality and camaraderie in your imbibing. I mean, like you can go to a baseball game, and what do? Get a hot dog and a beer.
Well, before COVID, Puff Puff Pass was a thing too.
Yeah, but it was still like, there wasn't a place that you can go do a puff puff. I mean, you'd have to be out with your buddies or something, somewhat maybe even trying to avoid detection depending on where you're trying to enjoy that cannabis. But you didn't have like a place that you can go and like get high.
Well, once a year, Seattle Hemp Fest.
Once a year at Seattle Hemp Fest. I get that. That was cool. That was a very cloudy and hazy time. I had a great time. All right. Well, let's see how the protest is going, because we still have some other news stories. Some are historic, but then it's like, well, does the stock market give a crap about this? That's how I'd really care. No, stock market doesn't care. It sold off a little bit. It was up there and now it's down here, but it's still up. And pot stocks today took off. Did you see the pot stocks?
No.
Oh man. No, they because Georgia went blue, everybody's now handicapping that the more act will pass. So pot stocks are up like 10% today.
Oh, that's given. I expected like Google searches and everything to increase by at least 10, 20%, the potential of. And then once the MORE Act comes into the Senate process. Oh my
gosh. Think about all the views we're going to get when we do the Senate telecast.
And then if it passes, the implication is going to be huge for anybody who enjoys freedom or money.
Yeah, I like freedom and money. I do. I think a lot of people do. So then trying to figure out like with the historic context of what's happening right now, when was the last time protesters stormed the U.S. Capitol in history? And I still was just getting stuff from like Donald Trump's protesters are storming currently. And then it looks like in May of 1971, protesters shut down D.C. traffic. But then I have like a list of the 8 biggest protests in U.S. history. And then our little question or quiz for the thing could be like, all right, well, when was the last time somebody actually stormed it, though? We'll talk about that one after the 8 biggest protests in U.S. history. Number 1, the anti-nuclear march in New York City Central Park. An estimated of 1 million people. 1995, the Million Man March came in at 850,000 people. April 25th, 2004, March for Women's Lives in D.C., about 500,000 to 1.15 million people. That's a pretty big gap. I mean, like if you're talking that many people, how well are you counting? If you have a gap of 600,000 people. Oh, you see, this is like when they start saying it's an anti-war protest in biggest cities. I don't know about that. Then Million Woman March, anti-Vietnam protest in 1969. Washington, D.C., 500 to 600,000 people.
Let me add, too, that there were shots fired in the Capitol today, too.
There's shots fired in the Capitol. Hey, that brings us to the answer to our when was the last time somebody stormed the Capitol question. It appears that it was 1954, a shooting in the House chamber on March 1st, 1954. While members gathered on the House floor, 3 men and 1 woman entered the visitors' gallery chamber and quietly took their seats. All 4 belonged to a Puerto Rican nationalist party and only hours earlier had traveled to D.C. And then there was a shooting. And so it was this separatist group from Puerto Rico came in and shot some people in the Capitol. And so there's some House pages carrying a stretcher with a wounded member of Congress on it. And that was 1954. So if Miggy's reporting that there were shots fired in the Capitol.
Yeah. What is, I just don't get it, man. Like the patriotism, it's not there. Like, I don't know what these fuckers' intent is because you're not proving anything, right? This cat, Joshua Stone here, you know how we get trolled with the whatever it is.
Yeah.
This guy, socialism is terrorism. Like, what? You enjoyed your $600 check. I don't know what the fuck these people are fucking bitching about. Like, coming up, well, you will enjoy a $1,200 check.
But if socialism is terrorism, then the cannabis industry is terrible because, like, a lot of socialisms in the cannabis industry, especially like in Illinois and New Jersey or in other states where the state picks the winners and losers, not the market picks the winners and losers. And so we talk about that all the time on the show, man.
We should talk about something fun, like, say, edibles.
Yeah, but like let's focus on the real important thing. The real important thing is the biggest story. The Democrats look like they're going to retake the Senate, and so Kamala Harris will be the deciding vote in the Senate, and that means that there's some halcyon days of the marijuana future where there's no such thing as marijuana anymore. It's gone back to cannabis, and it's helping everybody.
And it won't put you in jail.
Won't put you in jail.
That's the key goal right there, buddy. Like jail and internet commerce, right?
Right.
I mean, and then it'll help, like companies like we have on Wednesdays for our business show. Everybody's going to expand and be bigger, no matter what.
Yeah.
Oh, shit.
All right. Well, let's bring our guest, Jackie, on. Hey, Jackie, thank you so much for joining us.
Hey, guys. Happy to be with you. It's a big day.
Yes, it is. Can you tell us a little bit about what you're doing at 1906 New Highs?
Sure. So I work for 1906, our Chief of Policy and Health Innovations. My background is in public policy and public health. And so that kind of means I do a whole lot of everything, everything from the regulations that we need to operate in our states to what does research look like and how do we kind of push from inside the industry to do more and do better. And a lot of what I talk about is sort of that intersection between medicinal users and recreational users. I don't really think that there is a big difference. And I spend a lot of my time kind of dealing with that big piece of the Venn diagram of people who are therapeutically using cannabis. And that falls in line with a lot of our brand and microdosing. So happy to be here. Happy to talk on what feels like a really, historic day.
Yeah. So where are you guys currently operating?
So we currently have products on shelves in Colorado, Oklahoma, and Illinois. And we've got a few new states kind of coming online very soon. We like to tease stuff out on social. So our Instagram is the spot to kind of keep tabs on where we're launching new states. But
at Cannabis Industry Lawyer, where do we hit up yours at what?
At 1906 New Highs.
Nice. At 1906 New Highs. Don't forget to give that a follow. What types of products are you guys featuring?
So 1906, I think, hits such a sweet spot for so many consumers because all of our products are low dose. And we've got some of the most fasting acting cannabis on the market. We've got a patented technology. We work with a brand or a company in Canada to really make sure that we are feeling it faster. How many people have consumed an edible and waited 60 minutes, felt nothing, 90 minutes, felt nothing. Then they take another and then they have a horrible experience because they've way overconsumed, right? They thought they were getting a nice 5 or 10 milligram and now they've got 20 milligrams in them and they're miserable.
I'd say that's probably about like everybody. Like if you've used edibles before, you usually have that one time. But I think that's similar to people that have gotten drunk before. Everybody's like, "I'll never drink insert liquor here again," you know. And
the smell of SoCo to this day turns my stomach. Yes, exactly.
There you go.
But 1906 too. Can you talk about the significance of your name? I love the origins of the whatever.
Yeah. So for us, 1906, and thanks for bringing that up. Our name comes from the Wiley Act, which was essentially the act that created the prohibition on cannabis. Our belief is that, prior to 1906, people used cannabis all the time. It was in people's medicine cabinets. And so that's really what we aim to do. We have chocolates and confections in Colorado, but in all of our other states, we're exclusively pressed tablets. So the idea is that that's how we as people consume so many things. And then our product line is also experience driven. So for the consumer who doesn't know, a terpene, indica, sativa, and is pretty green, no pun intended, to using, you walk into your first dispensary and you're just completely overwhelmed. We take all the guesswork out by asking, how do you want to feel today, and catering our products to answer those questions, as opposed to, here's your PhD in cannabis, I hope you enjoy your joint. It's a little bit different of an approach. And I think for me, it just kind of fit in line with my background and how do you make people feel better, right? Where do we come at cannabis and using it as a way to increase the best, make it the best quality of life you can have.
Yeah.
So what background then do you come from where you have such customer focused outlook?
So my personal background, I started as a peer-to-peer sex educator at Planned Parenthood almost 20 years ago and got bit.
Thank you for your service.
You're welcome. I got bit by the policy bug because I felt like, look, I could have one conversation with one person about, what they're experiencing. But it became really clear, especially on things like women's health, that there are larger policies in play. And so I've spent most of my career as an advocate for patients. And I've been really fortunate to work both in state and federal government doing that kind of work around healthcare affordability and access. I joke that most of the time, I like to knock out all the controversial stuff. So I started with Planned Parenthood, spent almost a decade working on the Affordable Care Act, and then went into cannabis. So I'm no stranger to controversy.
Well, it looks like we have some fruits that are going to bear out now with the complete. I realize that right now this is the closest that I think we've ever lived, because I wasn't alive in 1954 when somebody stormed the Capitol and did a shooting. Like, the only time I've seen this was like on bad action movies from the 90s. And so, this is the closest we've lived in a coup, I think.
Oh, yeah. But I think good will win. Thank you, because the redundancies of the American policy and how things work. Biden's our new president. We have flipped Georgia. Maybe the MORE Act might, because that's going to be the next focus, right? For everything to be Jackie, I really like that you talked about wellness and cannabis use and how you select who uses what. I think all use of cannabis is wellness, right? If I smoke a little bit now, I'll drink a little less later, or none of it's all beneficial to our body in the end.
Well, and I think that's what 2020, God, talk about a year, right? But
a year that lasts for 10.
I feel like I aged a decade, right? But how many people turned to cannabis in that period of time? And I've heard, it's just because people were working from home so they could be home stoned. No, people were turning to cannabis because we were living with unprecedented anxiety, health anxiety, economic anxiety, and also just all of the things that we as humans are conditioned to do to relieve that anxiety. Gone is going to, hang out with your friends, or concert, a manicure, the gym, the movies, all of the social world that we had fell apart. And so I think cannabis came in because people had more anxiety than ever before, and really kind of showed people. And when we talk about why is cannabis increasing, why do we see this happening? More than 20% of cannabis consumers are boomers or older, and it's only growing by the day, right?
And you can't drink like you used to. Remember, as you get older, it's not like you're 24 anymore. It's like, well, I was out drinking till 4 a.m, but fortunately I got 3 hours of sleep.
Yeah.
No. And so I think it's great that you're really coming at them and explaining to them and spoon feeding them and saying, how do you want to feel? What's your experience level with the product? Because, 5 milligrams for me, I probably wouldn't even notice. But then, like, 5 milligrams for somebody who hasn't used it in 3 months or ever, they may.
Right.
What I thought about 2020 was like, this is the closest I've ever felt to being in space or in prison. And because but one of those, nice prisons, like the home confinement, like I just feel like there should be like something around my ankle saying I'm not allowed to leave because everything's closed.
Yeah.
But yeah, it's been crazy.
And I think too, right, there's always going to be a consumer that has been, using for years, and that their needs are in many ways being met. I think our process was like, who's the new consumer? And frankly, it's people who look like me. I'm a middle-aged soccer mom, in my late 30s, right? It's older women, it's older folks in general, and middle-aged women who are the untapped cannabis consumer. And so to say to, somebody, here, go smoke this joint, like maybe they don't want to smoke. Maybe they don't, they're intimidated by that whole process. They're intimidated by the stigma. And I think of it as how do you show people that there's a benefit, and then start to let them make their own choices about what they want to consume, right? I talk a lot about Doritos in this analogy.
The snack
you
chip.
buy the bag of a Doritos, right? The family size bag of Doritos, what you're consuming, and you're making that choice. I think for so many people, we're just handing them the big size bag of Doritos. And some people need the snack size bag, right? They need to get into it in a different way.
Oh, absolutely. I mean, because most people aren't like, I love this plant, and it's great, and I look at it like it's a fine type of thing to enjoy. That is such a small sliver of the population that uses the plant, and so I have to really remind myself that I have a warped perspective of what I'm looking at, And so it's great that you're out there making it accessible to more people that would never have previously considered it, especially for its wellness aspects. I mean, and this is interesting because your 1906 company kind of is at the edge of where like the medicinal kind of meets the adult use, in the sense that, you guys are in capsule form. And so what is your guys' philosophy on these types of doses that you help your patients with?
So I think first I want to talk a bit more about like that idea of the recreational consumer versus the adult use consumer versus the medicinal consumer, because there have been studies that have shown 60+% of adult use consumers, who we used to call recreational consumers, are coming in for a therapeutic need without a cannabis card, without a medical card, right? And so I think a lot of it is realizing that there are folks coming in very intentionally addressing pain, addressing anxiety, addressing insomnia, and how can you potentially show them other alternatives to smoking? And as somebody who's worked in healthcare for so long, that felt really honest to me, because people are allowed, again, to make their own choices, but I think having an option that isn't a smokable product feels good to say, here's another way you can do it. A lot of what we try to do is work on the educational low and slow, right? So you can take multiple of our products if you want 20 milligrams. Like you said, you wouldn't even feel 5. But trying to bring people into cannabis in this space of that almost micro-dosing level, 2.5, 1 milligram, take 3 if you want to, but can you consume all day at 1 and 2.5 and 5 milligrams for a better quality of life, as opposed to, smoking a whole joint at night, which some people, still do even after using our products all day. It really kind of depends on what you need and what you're looking to get out of it. I think that's like the beauty, right, of cannabis. Like the beauty of the plant is that we're finding new things every single day that we can, target and curtail. I mean, my mom rubs a lotion on her knees, right? Like doesn't even consume, doesn't feel high at all. Her knee feels a whole hell of a lot better. So,
because those pain receptors are more amenable to the CBD. Now, that's one of the things. Do you do a lot of outreach and education to your consumers and also just the general public regarding the endocannabinoid system?
I heard you're bringing on Ethan Russo next week, actually, who is like huge, like such a crush fan.
We're going to geek out. So like, if you want to see us just like going like, but what about this? What about that?
So I think a lot of what we do is educate the bud tenders, because we realize that that's the inflection point. educating the consumer when we are still trying to grasp, and the hurdles of advertising in cannabis, right? Like it's hard. I can't be in, pick name brand magazine, right? I can't take an ad out in that, even if it's an educational ad. So a lot of our efforts right now are at that bud tender level, because that's who's having the conversation and is able to say, look, if this is what you're seeking, this is what you can do. We've tried to pivot a lot in the new reality, because we used to have pop-ups in dispensaries. We used to have street teams, people out in community. That's all changed the last, 10 months, because there are no more concerts. There are no more street festivals. It's just a different world. So a lot of what I'm also trying to do and build out in places that are expressly medicinal, like Oklahoma, which is a fascinating market. Maybe we could talk about that. Is engage with physicians, right? Because they're the other conduit to people and the educational system there. So, I could talk to one person, or I could talk to the bud tender or the physician or clinician who's talking to dozens or hundreds a day.
Yeah, for sure. And I think you totally got a good point as far as the not everybody wants to smoke, because here in Washington, when we had I tell Tom, we had markets. We had markets where people would socialize, consume. Spaces for just flower consumers and spaces for just dab consumers. And some of the markets I went to, they were like, okay, no consumption in the indoor at all, because it bothered some people smoking, but they all did edibles and stuff.
Right.
And so it's a great niche that you got going on. And it's also easier to titrate, to figure out how high or whatever feeling you're going for.
Dosing, right? Exactly. Yeah. Right. Like, so you can really measure it down. And that's why I say take 2, take 3 if you want, right? But we know that you can have a similar experience. When we talk about like the new federal landscape, I also believe that eventually Medicare and Medicaid will get with the program. Looking in New Jersey, where I used to be a regulator, upwards of 50% of the patients were on some sort of federal assistance, right? And we knew that because they got a discounted registration card. That's how we had that information. I would be stunned beyond recognition if big insurance or our country's insurance, Medicare, Medicaid, will reimburse for a smokable product. I just don't see the reality of that. To me, it seems very preposterous. So gummies will be hard, confections, candies, et cetera, will be hard because of sugar.
Is there going to be the fine line between gummy and lozenge?
There is that weird fine line. But I think capsule, tablet, there's no calories in our product. There's virtually no allergens. We list all the other botanicals. I should mention that all of our products have additional adaptogens beyond the THC and the CBD that's in them to help elicit, sort of the preferred effect. And then that way, but like back to that idea of like what will be covered, we're looking at this from a much more of a pharma model as opposed to how do I make the best gummy bear? Because I don't think being covered by insurance.
Has creating or in your business plan or strategy, phrasing it as a pharma model, has that helped attract investors?
I think so. I think that they like the idea that we're doing something different, and intentionally so, right? It was, I joined the company 18 months ago, but at its inception, a lot of people laugh, how are you going to sell a low dose product? I would, like you said, I wouldn't even feel 5 milligrams, right? I think what's happened over time is that our sales have proven, our reputation has proven that a lot of people do want a different experience, and they want something that feels a little bit more measured and metered, and you're going to have the same feeling, the same experience over and over and over again. Starbucks gets a lot of flack for a lot of good reasons, but the latte you order in, San Francisco and the latte you order in the middle of Idaho and the latte I order in, my little suburban town in New Jersey, all kind of taste exactly the same, right? Yeah. And so there's something about that standardization that I think consumers really like. They want the dependability that they're always going to have the same experience. How often do people have a strain that works, for their pain or their anxiety, and then they can't find that strain anymore? So we try to eliminate a lot of that for folks.
So you guys probably extract profiles then of whatever plant you're looking for that effect. I'm looking at your guys' product listing, and you guys look like it's tasty candy. But what's the difference? Like, you got the drops, you have what looks like little chocolate bars, and you're talking about the capsule. So it's like the capsule inside, or
No, so the drops are the tablet.
Okay.
So the drop isn't candy. It's it
Okay.
might look like candy, but it's a swallowable, like an Advil.
Sure. That's awesome.
Yeah.
Yeah. Now, can you chew it, or is it intended to be swallowed?
It's intended to be swallowed. It's full of stuff that it doesn't taste good. It tastes like chalk. Our chocolates are amazing. We just Thrillist just last week named our peanut butter cup, our Bliss cup, one of the best edibles on the market. So our chocolates are really outstanding, but they're only available in Colorado. So if you're in Colorado, check us out. We spent a ridiculous amount of time getting the peanut butter just right. We make everything ourselves and work to single source chocolates and peanuts and everything. So we take a lot of pride in making sure that not only is it, feeling good, but it's tasting good. You're going to enjoy that peanut butter cup. You're going to enjoy that piece of chocolate.
That's great. Now, was that created in a licensed kitchen in Colorado?
It was. Yep. So we've got a manufacturing degree in Colorado. Or manufacturing license in Colorado.
Manufacturing license. Nice. Cool.
Yeah. Why do you think it's important that 1906, New Highs, and other cannabis companies commit to public health and social justice? And do you think alcohol companies should probably end up doing this type of thing as well?
I don't know if alcohol companies are going to do the same thing, because I don't know if both the stakes are as high and the injustices are as bad, candidly, right? There's a very long history of people being incarcerated disproportionately. I'm sure you have talked about on the show many times and brought experts in to rattle off all the horrible statistics that both have happened and still happen when it comes to communities of color. Mm-hmm. So I think it's a little bit different than alcohol in that respect. When it comes to the public health side of the house, alcohol and cannabis in my opinion, couldn't be further from each other, right? They're lumped together all the time as sort of ways we cope with the world, but there's legitimate medicinal benefits to marijuana. There aren't for alcohol. Name something else that you're using for epilepsy, pain, insomnia, seizure, the list goes on and on. So when it comes to public health messaging, which is like my personal sweet spot, if folks said, create your perfect job beyond the one you have, it would be talking about that destigmatization of this is what cannabis can do for you. And this is how so many people has lives have been made better. I was working in public health. I was working in the state of New Jersey. The opioid crisis was raging. And prior to the pandemic, it was the largest public health crisis of my lifetime, right? Everywhere we were dealing with overdose. Everywhere we were dealing with horrible rates of fentanyl getting into communities. And it wasn't
completely legal, but a legally created catastrophe.
A legally created, yeah, exactly right. With a lot of folks to kind of point fingers at, both big pharma, government, health systems. There were a lot of bad actors kind of either knowingly or unknowingly creating it and deepening it, right? I got more hard narcotics for a root canal than I did for giving birth years later. And it shouldn't have been that way, right? But what opened my eyes so radically, my exposure to cannabis prior to being in the New Jersey Department of Health, it was, HIV and oncology, people dying essentially, and so I had this this is just for those who are the worst of the worst.
But isn't that strange? Like when you think about it now, looking back, you're like, we were giving it to the ones that were the most sick, the most frail and enfeebled, and it was working for them. What the hell do you think it was going to do if you gave it to everybody?
Seriously.
Well, and what opened my eyes so much were individuals who were struggling with addiction, just, functioning addicts, people who were just popping pill after pill after pill to survive, and how cannabis radically changed their life. And that was when I started to go, wait a second. There's a lot more here than what my background sort of looking at I had a dear friend who was at Drug Policy Alliance. So I was kind of up on the ACLU sort of social justice angles of it all. Yeah. But I was I had a lot to learn in those years about how much it could help people struggling with addiction. And for me, I think that's where the public health conversation is going to go in time. It's like, how do we take a country full of people addicted to opioids and help them manage the reasons they're addicted in the first place? Of course, but cannabis can be a big part of that process.
When you were there in your public health career, were you aware of the endocannabinoid system?
I don't think prior to joining the Department of Health and having the medicinal marijuana program under me, I worked in federal government and I worked in healthcare for quite a while, and I was not aware. I had the blessing, the misfortune, either way you slice it. Third day on the job, Governor Murphy put out an executive order to overhaul the program. I was still learning where to park my car, and I had to now take on this huge endeavor. And so for me, it became, a really great opportunity. He gave us 60 days to do it, which in government time is any time. 60 days to put a report together is a blink of an eye.
They do that all the time in this industry, and it kind of is. I will sometimes report on like how the industry may be rigged. And that's one of the things where you're supposed to have your entire application, which is over 1,000 pages, done in 2 months. Like, here's the application. We want them in a week. Well, that's not that bad. Like, the worst one was 5 weeks in Georgia. So like November 23rd to December 28th, Truly filed a suit to try to kick it out. But Illinois was just 2 months and COVID elongated it. What's the application window in New Jersey?
So the application window, I'm trying to remember, I feel like applications came out the last time in end of June and they were due the end of August. I know they were due the end of August because I didn't sleep much the month of August. Yeah, that's sometimes how it works, both for the receiving end, right? Here you are, here's your brand new job, figure out the whole department, and give me this report in 60 days. And now I see it on the other side as someone in the industry.
Yeah. And then from your experience in the New Jersey market, can you explain a little bit about the New Jersey market? Is it a limited market or is it an open market?
New Jersey is an incredibly limited market. So I could geek out on this all day, but the quick
That's why we have you here.
Hey!
Cannabis Legalization News, where we geek out on the cannabis industry. Give us likes and subscribes. Yeah.
So a Republican governor, Chris Christie, signed, or excuse me, a Democratic governor, John Corzine, signed the original medicinal bill into law, but did it as he was walking out the door. It was part of the lame duck package. Under Chris Christie.
We had that in Illinois. His name was Pat Quinn. And then Bruce Rauner came in. And so you had the same thing. Lots of parallels. Yeah. So
for 8 years, the program just kind of hung out. And unless you knew how to get into it and who to ask, and most of the time it was like an oncologist or a pain specialist who kind of was hip to this, right? Who was advocating for this. There's 17,000 patients out of a state of 9 million. I don't know what the percentages is, but that's really, really, really tiny. We had a really heartbreaking story of a young boy who had cancer, Jake Honig, and his parents got the governor's ear on the campaign trail and just said, look, this is the one thing that helps Jake act like Jake again. But because of the limits, at the time it was only, I think, 2 ounces per month. And the parents were making their own oils, right, out of the flower, because there was virtually no tinctures, no lozenges. They were running out. And they also had the heartbreaking story of burning whole batches and just screwing it up, right? Because they're doing it themselves with the help of the internet, which is not how you should administer medicine to your children. You felt for these parents so profoundly. And I think that lit the fire under Governor Murphy as he was running, and then when he walked in to really say how do we get this right for people, and that was really inspiring. I think it's been frustrating to see how closed the market has remained in the 3 years he's been in office, and there's a whole host of reasons why that is. But when I come back to my roots in healthcare, it's affordability, access, and quality, and you don't get any of those things in a small market.
Limited market. And so we talk all the time, and it's a very comparative show because we'll have people on from all over the states and we compare them, and the whole goal really is to create efficiencies for that next state that comes online. And there's some stuff that New Jersey does that I think is really, really nice. But then there's some stuff that I'm like, this might just create a huge, problem of litigation and delays. And the only people that are really going to be hurt by it are the patients. And then also, of course, the businesses that want to get in.
Mm-hmm. Yeah. So New Jersey has been embroiled in a lawsuit that has stopped any new licenses. So there was a RFA in 2019, and no licenses have been awarded. There are 12 license holders, but I believe of the 12, only 10 are operational. So I mean, it's a really, and again, 9 million people, right? And okay, so you're only taking from the medicinal population right now. It's still over 100,000 New Jerseyans. It's grown that much in 3 years, but they're being served, by such a small group, and it's heartbreaking, right? Because this is people's medicine, and horrible waits in the beginning of the pandemic, right? Lines around the block of people in their cars trying to get product. Tons of drama trying to just keep up with supply and demand. There are shortages every single month, and have been and will be until the market expands.
And I think the stigma helps make that thing stagnant, right? So like earlier, how you were talking about how it took a sick kid to get your governor to wake up, but also like earlier how we were talking about how you're talking about people being stoned at home during COVID, during this pandemic, right? What's your image? What is stoned at home? Stoned at home for me means I'm doing goddamn laundry and fucking doing yard work and tending to my kids and running errands. That's what stoned at home means to me. Like that image is just BS. Granted, I would love to just be couch locked and play video games all freaking day on Twitch and like make some revenue that way, but it doesn't work that way.
You haven't figured that magic out yet? No, but I mean, there were a couple of interesting New York Times pieces during 2020, right? And they kept just like driving home this idea that cannabis and alcohol were connected, which I categorically disagree, or were the same, which I categorically disagree with. But what they did do right was talk about how often it was, moms taking a hit of a vape pen in the bathroom in between homeschooling 3 different kids across 3 different classrooms, and just the chaos of that, right? Like, that's what stoned at home was in 2020. It was unprecedented chaos, especially for parents, working parents, all parents, right? It was so much tumult. I think that idea is that you're right. You're doing your laundry. You're juggling your kids. You're cooking dinner. Yeah. You're Zooming with family members across the country who you haven't seen in a year. You're going to virtual funerals. Like that's what we were doing that year. So I always recalibrate to like, really, what does that mean? I hear you loud and clear.
Yeah. And I really hope they get the license type right out there, because those poor people that are trying to access that vape pen and make sure that distillate is of high quality and purity, like the type that you can get from a regulated market. I hope that, like, I was doing a piece on the New Jersey micro license, and the micro license isn't micro. It's like 1,000 plants. That 1,000 plant facility is going to cost a lot of money to build. And then you have to go, I mean, you're going to make hundreds of pounds, and then you're going to have hundreds of pounds of trim. You don't have that license. So what are you going to do? And then are you going to already have a contract with another processor who's going to buy your trim? Or are you going to have to also try to get that license? And that puts the price up. And okay, now you get to go sell it. All right, well, what dispensary wants to stock your product instead of their own? Are you going to then also have to try to get that? And so, like, by the end of the day, when I was done with this piece, like, I was already at a $10 million capital investment. And I'm like, how does this put the black market out of business? Why isn't there that micro grower license that you see in like a Michigan? It's just that their Class A 100 plant license, where, you could probably open that for business for hundreds of thousands of dollars, maybe $500,000 at the top end. There you go. Now you're actually getting into a price point where people can afford it. And then I think with the MORE Act passing, though, it will be fascinating if they can actually get SBA loans, because that was an aspect of the MORE Act,
And I think that, come back to, why does alcohol play or not play in the social justice space, right? Because of some of the things you just mentioned, right? Who has the capacity to build that kind of equity, right? On top of just like life, it by design becomes an industry full of people of wealth and affluence, right? Yeah. Who can do that. if you look at pharmacies, states set parameters of who can be a pharmacist, what, the FDA regulates what what prescriptions you get. But states don't get into the business of how many CVS's or how many Walgreens or how many Rite Aids you have. And it becomes a town by town decision about how do we serve the needs of our community and what do we want.
Yeah.
And the same is true of liquor licenses, right? So I hope that is where we collectively get, because I think that's how you start to be more accessible and allow for more people to have more robust hands into the market. Because if it's $100 million or bust, I mean, how is that ever going to become an equitable market? And I push back on that because I think the social justice work, right, expungements, decriminalization, and equitable markets are two things that sometimes get like all lumped together and are actually radically different, right? Pushing your legislature and your governors to do what just happened today and do massive expungements and creating opportunities to get people into the cannabis industry, like we shouldn't just treat them as all one big giant thing, right? Like I fundamentally think you need different solutions to address different problems, and instead we kind of all capsule it all together. And I think that's very disingenuous, both as policymakers, right? My old hat, but also inside the industry, because not everybody can do everything, and how do you start to really hold what you can do best as a company? So when you want to compare us to alcohol, who are you giving to and how and why, right? We do everything from large scale philanthropic, contributions to working with a place in Denver that caters to LGBT youth who have been kicked out of their homes, right? So like super micro local, but that's important. And I think that sort of outreach into real communities has to come both from the policy level of what do you do to change, but also from inside the industry pretty pronouncedly. We did a great program during the beginning of the pandemic called Friends in Weed, where we actually worked to take local restaurants and give gift cards from local restaurants to local bud tenders who were also out of work. So it like helped everybody. So when you gave a donation, it simultaneously helped a bud tender who might be out of work, but also helped local restaurants who were, independently owned mom and pop businesses. And I think some of the programs need to look at more organic local things like that, instead of just where can I write a check to feel good about myself, as opposed to like, how can you be invested in your communities?
Yeah, I think that's great. And I also, when they have these types of social equity windows of licensing, and the licensing window is 8 weeks long or 4 weeks long, and then you don't know if you get the social equity points or not. So like a lot of people got disqualified for social equity in Illinois. They didn't even get notice of it. And so in the Detroit legacy license round that they have coming up this spring, it's a method and it's a pre-qualification in Michigan. So like there would be a pre-qualification rounds for perhaps like the micro growers round in New Jersey, so they could establish that it actually is 51% owned by people in New Jersey. And then it also has the right locality restrictions, because like wherever that micro business opens in New Jersey, the owners also had to be local from there. And so if there's this first step to establish whether or not you're, a micro business or social equity or a Detroit legacy, prior to doing the entire license window, you're not going to have these types of shenanigans that then suddenly happen. I mean, you would have already been pre-qualified as a social equity or pre-qualified as a veteran or as a local resident, and then you could do your narrative and all the other stuff that is thick.
I gotta figure it out.
What do you got?
Once the MORE Act passes, and we're gonna reallocate the funds to the DEA and all this police funding, all the wasted funding, right? And we're gonna take all that money and put it towards education to the 70 million dumbasses out there who don't understand how the Constitution or all the other shit works out. So
I don't know, man.
For everyone.
Yeah. I bet we could probably find people that just like they think the Earth's flat. They'll be like, "There's no such thing as the endocannabinoid system. There's not. It's not a thing. You're just lying. You're just a drug addict. That's what it is."
But you know what though? Cannabis outpaced everybody in Montana, South Dakota, Arizona, New Jersey, by like huge margins in some of these states, right? So yeah, there's always flat earthers, but I think look at how many medicinal patients are in Florida.
Yeah.
Oh yeah, it's
Right?
like
Like
300,000 or
that
more
to
now,
me-
right? Yeah.
It's since I think last time I looked, it was closing in on 500,000, maybe more. That to me proves that like the toothpaste is out of the tube, right? The federal government has to catch up, and we now have potentially, if things continue to go the way I think they're going to go with what's going on in Georgia, they have to figure out what to do and how to address some of the stuff in the MORE Act, but go beyond that. I mean, research, right? Do some real research. Send the NIH some money, or even better yet, faster and a zero calculation on your budget total here. Just allow hospitals, give the Department of Health the credence, have the secretary write a memo that says, look, if you want to research cannabis in your hospital, in your health system, your Medicaid and your Medicare funding will not be impacted, and there are no federal repercussions. So as long as you do it to the standards, you have a review board and you do it to the ethical standards of clinical research, that creates such incentive. There are so many physicians and clinicians that are eager to do this research. So many young people, right, who are like early in their careers and are hungry to be the next Ethan Russos.
Oh, yeah.
But also destigmatize through knowledge, because I think that's how we get there. I think the research is going to be key. And it doesn't mean you have to allocate money to NIH right away. It just means you have to let, local hospitals and health systems do the research without this fear of somebody coming down and cracking down and them losing all their federal funding, because that fear is real. And I think those are easy things that I hope the Biden administration can tackle. That was on my hit list before I thought we might have the Senate. I think now with the Senate in play, we've got a lot more to do. I will say that we've only got 12 months, because the House is going to turn around and get ready for re-election, soon. And I think that is going to become really important for all of your listeners and folks who are sort of activists in this space to remember that this isn't a 2-year window. This is a 12 to maybe 16-month window to get things moving, because you cruise into the beginning of 2022 and most of the members of the House are going to be consumed with getting reelected. And unless they can tie cannabis to that, it becomes harder.
Yeah, but that's one of the nice things that, with it was a bipolar vote. Like we were on the air when we were doing the MORE Act vote. It was 95% for, 95% against. No overlap whatsoever. My own formerly owned, I'm not going to vote for her anymore. I'm not going to vote for the other guy though either. Sherry Bustos is one of the 6 Democrats that voted against it. I'm like, come on.
Yeah, right.
But when you talk to real people, I say all the time, it's like the most colorful political rainbow you've got is the cannabis voter.
Yeah.
Think of anything else that's controversial, almost always comes down to party lines. Abortion, gun, pick something. It's almost always a party line thing. Cannabis isn't. Pretty wildly not so, right?
Unless you're a member of Congress.
Unless you're a member of Congress, right? So how do we as the general public inform our elected officials? How do we get them to vote with our best interests? I don't know. That's the
get them out.
saga of my life, I guess.
We once had Senator Dalen Leach from Pennsylvania on discussing SB 350 in Pennsylvania. And he goes, no, you just don't get it. You have to think like a politician. How does this make me look? Why does this matter to me? How is this going to benefit me?
Yeah.
Will this do anything to harm my constituents? I like how it was me, my constituents.
Right.
Yeah.
And that's not everyone. I've worked for members of Congress who are amazing people. But by and large, I teach at a local college here, and I teach a course in advocacy. And I say that power is people and money. Yeah. And many elected officials are driven by that quest for power, and they see it as money first, people second. Not all of them, but a lot of them do. And I think, unfortunately, because of the way that redistricting happens in many states, districts are getting deeper, of whatever color, they're getting deeper down those holes. And so it used to be harder for people to really be so dogmatic and so just entrenched in one point of view, because their districts were a lot more purple. Even if it was like a purple red or a purple blue, there were a lot more purple districts. And I think that over the last 2 decades has pretty radically changed throughout most of the country. How people view it. Healthcare seems to be the thing that tends to break that up. I mean, you saw that a lot in the midterms last cycle. I think it's a big part of what happened this year. I think some of it was Joe Biden, some of it was anti-Trump, but a lot of people were really scared and wanted a party that I think could rally behind what does affordable, accessible healthcare look like. But that's my own bias of doing this for 20 years.
But the whole thing, like those people who were against the healthcare, like the whole get the government on my healthcare, get the government on my Medicare. You're like, dude, I don't want to break the news to you, but Medicare is the government. Like that's the process.
Or like they say they aren't socialist, and then they go buy from Trulieve or Cresco or something. It's like, well, you realize this was a hand-picked winner by the state. So like if you don't support socialism, I guess home grow is the way to go. But then you don't get home grow. It's terrible.
Yeah.
And just the cannabis issue is not just a single voter issue. It has so many levels to it that'll just make America better, right? Everybody wants to make this great again, but how about we just get better?
Well, and it's also jobs. It's local jobs.
Local
right?
jobs.
They're local. There's no way if you have a license in any state, that's where your people are going to operate, right?
And you got to grow the plant. It's like farming chickens or anything else. You got to do the work. Like it doesn't grow itself, even though with all the fandangled, nice, fancy stuff that somebody wants you to buy when you're, conducting or putting together your state-of-the-art farm, you still have to do the work. Yeah. And
I think even if we start to get some change in the federal relationships about how we do interstate commerce, and if we start to allow for that, I think that's a stretch, but I think there's a lot of people eager to get there. That's not on my 12-month goal. That's on my 10-year goal, candidly, or 5-year goal, right? But I do think that you bring in an incredible commitment to hiring locally. We have that, in all the places that we operate, we try to strive by that. I think that's how you get at some of the social justice pieces of it, is you bring people into good paying jobs. We applied for a license in New Jersey. We haven't yet won it because of the law, or, no one's won anything because of the lawsuits, as I mentioned.
Welcome to Illinois.
Yeah, but, we have a program to train formerly incarcerated individuals, and then not just train them, but then hire them, right? And if we can't hire them, find other people who will hire them and do job placement. So when we start to talk about what do voters want? People want jobs. People want an opportunity. People want healthcare benefits from their employer. Like, be a good business owner in your community. I think can really be a different opportunity than just saying whether you do or don't like cannabis. Like, where else are we going to create a ton of jobs that isn't on the back of the federal government, right? We could do infrastructure, but we have no money. Like, everybody's like, well, make broadband accessible, make Wi-Fi everywhere, fix all the roads and bridges. Of course, I would love to do those things, but that all costs money. And this is an opportunity to create local jobs, I think, and local tax revenue that doesn't require government to do anything other than, frankly, getting a little bit out of the way, right? Regulate the product, come up with some standards, make sure it's safe for people, but then let the market do what it'll do. And I think supply will prove that there's a lot to happen.
Yeah. I mean, I like to go out to restaurants and eat, and they have health inspectors and they have local health regulations in place. So I'm not poisoning myself. They can do that with cannabis. Exactly. And I realize that cannabis is kind of like a casino to a certain extent, because you are taking the plant and you are turning it into something that is fungible for money. And it's not really heavy. It's not like, if you're trying to steal $1,000 worth of weed or $1,000 worth of wine, you might need a wheelbarrow for the wine. It's heavier. And so I understand that you have security needs and you need a vault, but that vault doesn't have to be stuffed with cash if it's federally legal, know? And so there's still going to be security requirements. They'll come down a little bit, and the price will also come down. I mean, the supplies, what we did me and Josh for the Talking Hedge podcast. And if you guys haven't subscribed to that one, you should. We were going over the year in cannabis, talking about the trends in various states, and Washington State was basically sideways. Not very much tourism this year. And so the demand is there, and there's a lot of operators that can grow. And the price is stable. I mean, you can get a good eighth for $80. I'm sorry, $40, not $80. Yeah.
Well, I mean, look at, again, going back to the pharmacy model, right? You lock up a pharmacy, there's security, there's actually things in that pharmacy that can kill you, full stop. And I have 2 pharmacies that I could walk to from my house in the middle of suburban New Jersey, right? So like this idea that we couldn't possibly get there, I think is a very cautious and sort of fearful posture, as opposed to like a more abundance driven posture.
Mm-hmm.
Jackie, thank you so much for joining us today. Once again, where can we go to find and follow what you guys got going on at 1906 New Highs?
Hit us up on Instagram. We're at 1906 New Highs, and that's where you can find all our cool products, where we're listed. You'll find our website, and you can also get some cool merch.
Awesome. Thank you so much again for coming on, and thanks for tuning in, everyone. Make sure you like and subscribe to keep up with all cannabis legalization news. We'll see you on Sunday.